too. We're giving everybody a quick opportunity just to get logged in and get audio set up. I'm going to be sharing my screen here. So if those of you that aren't in already, if you could please maybe just give us one in the chat or a thumbs up in the chat, something just so that we know that you can hear us okay. And as I'm bringing up the screen share, yeah, just give us a thumbs up or an emoji. Thank you, Brittany, if everything is clear. There we go. Perfect. All right. So again, I'm going to go on mute just for another minute or so while we let everybody get rolled in here. We'll be getting started very, very shortly. All right. Okay. So hopefully everybody's in, has their audio set up now. I'll give a quick little bit of background here. So, my name is Liam. I'm one of our solutions engineers here at Compliancy Group, and I just happen to be our webinar guy. So, I'm going to be running and hosting the session for today. One of the things that I'll say here just to start is that this is probably going to be a little bit more advanced than some of the other webinars that we do. If you are familiar with the typical educational content that we put out, we usually are kind of breaking this down very, very basically. We're still going to be trying to keep to the basics, but also hoping to give some more in general insight for those of you, particularly those of you that are in more like mid-size organizations. And so compliance becomes particularly challenging the larger that you get, especially as you add more people, more departments, more locations, more things that might need to be tracked. And so everything that we're going to be talking about today is going to be based on the idea of the OIG 7 elements of an effective compliance program. We're going to be really honing in on each of those elements, giving you some key tips and tricks on how you can be implementing them, you can be tracking those things, with a really big emphasis on that word effective. Okay. Especially from the perspective of the OCR as well as the Department of Justice and the way that they are currently assessing and auditing organizations against these rules and regulations. The effectiveness of your compliance program is going to become something that you are measured against above anything else, right? As most of you know, this simply is not like a check of a box thing anymore. You need to not only implement the guidance that is given by the government and satisfy the law, but you also need to show that you're doing it in a way that is made specifically effective for your organization. And we're going to be talking through a lot of those different points today. All of our webinars are recorded. So you will receive a copy of the recording as well as a copy of the slides by the end of the day today or tomorrow. So just give it like 24 hours for that to be sent to you from the system. We always get lots of questions like that. I'm sure we will get another question at some point on this webinar asking about the slides or the recording. Rest assured, you will be receiving it. The other thing I'll say is you'll see on the panel here that you have the ability to ask questions and put things into the chat. What I would just request is if you have a question, please put it specifically into the Q&A feature. One of the reasons why that helps us is that if you have questions as you go through the webinar, you'll see that you actually have the ability to upvote questions. So if you see that somebody else asked a question, you can add an upvote to it. We are going to be specifically monitoring that section at the end of the webinar, and we're going to be doing a little bit of a Q&A section as we round things out here. So before we actually get through to the content of today's webinar, we always like to do a little bit of and let me just actually lower my screen resolution here. I think it's telling me I have an unstable connection. So before we actually get into the content of the webinar, we're going to run just a couple of polls with everybody to get a quick gauge on a few things as far as not only the size of your organizations, but what you find to currently be the most challenging aspect of managing compliance. And so you'll see that this poll is going to pop up on your screen now. It's just simply asking how many employees are in your organization. If you could answer that question and just give us a quick idea as far as what we're looking at here, that would be fabulous. It looks like actually a pretty broad range. So uh, even amounts of those of you with 1 to 50 as compared to 500, and then a decent sized spread of people between 50 and 500 employees as well. So that's really good to know. I will say that for those of you that are in that smaller category, I will do my best to make this as clear and relevant for you as possible. For those of you that are maybe a little bit larger, a lot of what we're going to be talking about today is going to be specifically oriented for you. So figure those of you in that 50 or above category, we want to try to make sure that you're coming away with things that are specific to your environment. But seeing that we have so many people that are in that smaller category as well, I will make sure that we are specifically targeting that as well. All right. Now, one more thing to publish here. So let me unpin this from the screen. Another question that we have is, how do you currently manage your compliance efforts? There's a couple of options here. You could say through spreadsheets or manually are kind of the same thing. If you have what you would say is predominantly manual processes, go ahead and put manually. If you're using spreadsheets with maybe a little bit more workflow automation, go ahead and answer that. If you're using different types of software tools, maybe to manage this internally, we could dig into all of the different options that are available for things like that as we go through the webinar. And I'm seeing that again. It's a pretty even spread. Most of you are saying that you're managing it manually. Uh, Next up is through spreadsheets, and then closely following is through software. Thank you all so much for participating in these polls. It just helps us get some good insight. So, especially understanding that most of you are doing this manually with spreadsheets, we'll be focusing in on maybe some things that you should consider as far as technology. I will say for those of you that are above 50 employees, that is really when it starts to become especially difficult to manage this with manual processes. Okay. So we'll be talking through ways that you could do it, maybe taking those manual processes and enhancing them. We'll also be talking a little bit about how you can utilize technology to do this a bit more effectively. Both, there's some premium options and then there's very inexpensive ways to do this as well. So let me bring down this poll. And last question that we have. What do you find to be the most challenging aspect of compliance? You're going to see this pop up on your screen now. Policy and procedure, risk assessment or risk management, training of employees, incident management. We have a pretty broad smattering here. And we're just giving it a quick second to let all these answers roll in. So it's a very, very close tie between policy and procedure and risk assessment. Very, very close. Looks like risk assessment is definitely edging out policy and procedure. And that's interesting to see. It's a very, very common problem within the space as a whole. And thank you all again for voting. I'm going to go ahead and unpin this now. Risk assessment tends to be one of the biggest pain points for most organizations. Not only is it a really big pain point, it's actually the number one reason organizations get fined, particularly by regulators like the OCR. Okay. So the OCR, among all of the HIPAA fines, let's say, that have been levied historically for things like privacy and security issues, ransomware attacks, all of that sort of stuff, 70% of the fines levied through the OCR were due to missing or inadequate or ineffective risk assessment documentation. One of the things we're really going to be honing in on today is that idea of risk assessment. It's closely followed by policies as far as how you all voted. And so we'll also be talking about policies, which is Obviously super foundational to the compliance program. When you think about what are you complying with, you're complying with your policies, right? That's what this is all about. And so, thank you all again for participating in those polls. That gives us some really great insight. Hopefully, for those of you that are listening, it also kind of makes you feel better, maybe about some of the challenges that you're having and the difficulties that you're facing. 'Cause a lot of you are probably in the same boat, without question. So, without further ado, let me go ahead and we're going to get into some of the content here. First thing I'll say is just to give a very little bit of background on our company. Those of you that are on here may or may not know anything about us. Our company is called Compliancy Group. We have been around for close to 20 years now. We have engaged in some way, shape, or form with over 5,000 organizations, large and small, all throughout the country, throughout our history and time in business. And our mainstay within the space is that we have never had one of our clients fail a government audit, investigation, or be fined. And that's not to give us a pat on the back, right? That's just to say the things that we're going to be talking about today, the principles, the tips, the tricks that we're going to be going over are things that truly have been proven to work. Okay. We've, knock on wood, we've never had a client fail an audit. We are really trying to keep it that way, ideally. And our hope is that we're able to share some of that wisdom with those of you that are on the presentation today so that you have actionable tips, things that you could bring back to your organization that are very practical that you can begin implementing even today. Okay. Now, with that background, we're going to go over some very basic of the basics. Okay. This whole webinar is going to be about these 7 fundamental elements of an effective compliance program. If you don't know what this is, or you're not familiar with this, highly recommend that you look into it. Okay. When it comes to healthcare compliance, this is really the boilerplate expectation for all healthcare compliance requirements. It doesn't even matter what it is. You could be talking about privacy. You could be talking about data security. You could be talking about things like fraud, waste, and abuse, Stark. Everything is ultimately being regulated by the OIG and Health and Human Services and what they define as being the core components of an effective compliance program. We are really going to be honing in on each of these as we go through today, but similar to what I said at the beginning of this presentation, the most important thing to be thinking about as we go through this is just this word effective, okay? When you're dealing with regulatory requirements, most of them are written in a way that is almost intentionally vague because of how broad they are. So you even think about the people that we have on this webinar. You might be on this webinar and you are a very small private practice. You might be on this webinar and you work for a large medical center or a regional hospital group, and then you go all the way up to the largest healthcare payers and hospital systems and networks in the country. Most of these rules and regs apply to everybody in exactly the same way, okay? And quite often there's very little differentiation between the rules that apply to a small practice compared to the much larger groups. That's in some ways intentional in the eyes of the government because they don't really want this to be a check of a box. It's not meant to be that way. It's what they are intending is that you are understanding these guidelines and implementing them into your specific situation, your unique organization in a way that is effective for you. Because what's effective for you, depending on your scenario, is might not be effective for the organization up the street. What's effective for a large hospital system is probably going to be overkill if you are a small practice, but we need to be careful that nobody goes sideways here, right? When we talk about that idea of effectiveness, it is not that anybody can do less than what the law requires. There's no such thing as partial compliance or being mostly compliant, right? It's a kind of a black and white sort of a thing. You're either satisfying the law or you are not. It's really just a function of how can you satisfy those requirements in a way that actually makes sense and is effective for your organization. And generally speaking, there is a life cycle that we recommend following within this. And so we're going to be breaking this down much further and going through each of the 7 elements. But in general, one of the what Health and Human Services calls the foundation of a compliance program is going to be risk assessment. Risk assessment is not only sometimes the launching point of compliance, it's how you show your work, it's how you maintain the program, it's how you prove that you're making a good faith effort, and how you document these things in a way that is effective for you. So when we talk about this life cycle, you'll hear me come back quite often to that idea of internal assessment. And for those of you that are struggling with that right now, we'll be giving some tips and tricks on how to simplify that. But I cannot emphasize this enough. 70% of the OCR's fines that are levied are due to missing or inadequate risk assessment documentation, not only because there are organizations that just are not doing that assessment, but even if they are, risk assessment documentation in and of itself is borderline incriminating, right? What you're doing is documenting your potential gaps. This next step here of not only gap analysis, but also remediation is equally as important. When you're doing these types of compliance assessments and you find an issue, you need to implement corrective action or remediation plans to make sure that you're also documenting how it's being addressed. Those types of resolutionary actions is how you show your progress. So you prove that you're making a good faith effort. Otherwise, you need to just keep doing those assessments over and over again and hope that you show progress. Okay. You should be doing it periodically anyway. We'll talk more about that. We recommend some things a little bit differently. That then bleeds in really well with the whole concept of policies, procedures, documentation, employee training, making sure that everybody's attesting to your policies, because that's really going to be, we'll talk about this more as we go through, but making sure that you have very clear policies that identify the risks that were found in your assessment, and that you are then training your people on those policies and just providing them with good quality training and education in general. That is how you mitigate the overwhelming majority of risk in healthcare. There was a study that came out through Stanford that showed that 88% of even cyber-related incidents in healthcare happened as a result of human error. Okay, most of the major risks, breaches, potential for fines, even financial issues for things like fraud, waste, and abuse, it's not failing technology. It's most often failing people. And that might not even be dishonesty. It could be just incompetency, right? It could be that your people don't know how to recognize a cyber issue. They don't understand what fraud, waste, and abuse is. Okay, they don't know who to report things to, and that creates issues. Then you have third-party risks. You have the need to manage any incidences that occur properly. And then guess what? You do this all again. You continue to reassess, identify gaps, implement corrective action, make sure that your policies adequately are a reflection of those risks, that you're training your people. This is the life cycle of a compliance program. We break this down in this way because sometimes it can help to think of this as a process instead of just the 7 laid out components. We're going to be going through this a lot more thoroughly throughout the rest of the webinar here. I'm just going to be checking to see if we have any questions quite yet coming through. As I said before, yes, we will be able to send everybody a recording of the webinar. You should be getting that by the end of the day today or tomorrow, right? So without further ado, let's break this down a little bit more thoroughly. As far as each specific component of the 7 elements, how you should be thinking about this, how this is going to impact your company, and some tips and tricks as we go through. Similar to what I said before, when you think about compliance, it's impossible to comply with something that doesn't exist, right? And so when we talk about a compliance program, even outside of risk assessment, which is often how you identify the policies that you need, right? If you're starting from a clean slate, let's say, policies in essence is kind of the starting point of compliance, though, because what you are expecting people to comply with is the policy. Okay. And so policies and procedures will be unique to every organization. You should be going through a process to not only identify the policies that you should be implementing, and usually, so let's say for things like privacy, data security, safety, fraud, waste, and abuse, right? Corporate compliance. You probably have HR policies, your employee handbook, your code of conduct. There's a lot of layers to the idea of policies and procedures. Those of you that are in very, very small practice environments probably don't need anything insanely robust, Those of you that are much larger, the larger that you get, the more formal documentation that you're going to need as far as the expectations and the ability to prove that people are complying with these things. Okay. Every other component of the 7 elements deals with how you communicate, implement, and enforce the policies and procedures that you have created. So when we talk about effectiveness, the policies themselves, in the first place, have to be uniquely tailored to your needs as an organization in order for them to be seen as effective. But then, the other layer of effectiveness is that those policies also need to actually be followed, okay, which is what we're going to be talking about next. There is a big difference, though, between just creating a policy and implementing it. One of our recommendations is that once you have created your policies within your organization, you should make sure that you create some sort of a review or a reminder schedule for each of those policies. And that's number one, just a helpful way to ensure that those are being kept up to date. So let's say that you're reviewing policies on it could be on an annual basis. So you spread it out throughout the year so that you're reviewing specific groups of policies each month, can sometimes make this a little bit easier. And then when you do the review of the policy content, also take that time to look into some of your departments and determine if the policy is actually being followed, right? Are the procedures and the operational workflows that you are laying out inside of those policies and procedures being adopted by the departments that it applies to? Okay. So when you're reviewing policies, it's worth actually just looking into making sure that they're being implemented and having some sort of a review schedule where you're getting automatic reminders. And again, this doesn't have to be an expensive piece of technology that does this. It could just be a reminder from your calendar letting you know this month I'm going to review these groupings of policies, and have that be something that's on autopilot for you, so you don't have to be thinking about it constantly. Okay. Next is going to be compliance leadership and oversight. Okay, so those of you that are on here, I am assuming in some way, shape, or form have oversight of your compliance program. If you cared enough to be on this webinar, you probably do. Now that you have policies and procedures, right, the next element is really self-explanatory, which is that there needs to be actual leadership and oversight of the compliance program. And this starts at the top, right? So with the board and the C-suite, down to more specific roles like compliance, privacy, security officers, down to more director and management level roles, and even your entry level employees. Okay. That infrastructure of identifying who does all of this roll up to and what compliance concerns are handled by what person should be something that is in your policies, so that employees know and understand that chain of command and who this comes from and who they're supposed to be notifying if something goes wrong. The reason why we mention the board and the C-suite here is because the DOJ specifically has released, the Department of Justice has specifically released guidance stating that they are recommending auditors and regulators to specifically audit and investigate board and C-suite involvement in the culture of your compliance program. Okay. If you're not able to show board involvement or proof of compliance, it could be something that becomes a problem, right? And that's why the idea of having a compliance committee as well, that has maybe even board members involved in it, that allows you to create approval workflows for policy, make sure that there's clearly defined lines of communication and chain of command that's there, really, really helpful, okay? And those people should meet on a regular basis, right? So the board and the compliance officer, the compliance committees that you have in place. And again, a compliance committee is really necessary if you are a slightly larger organization, right? If you're like 100 employees or more. If those of you are on here who are a very small practice, you might not need a full committee with tons of people on it for compliance, right? But be thinking about this as far as, is it clear to everybody in your company who they are supposed to go to for specific compliance issues? And that could be compliance, privacy, security. Do they know who to go to? Okay. And if you really think about that, and that is very well understood, it's in writing, it's published to everybody, and everybody knows who to go through, you are probably in pretty good shape. If it's completely not clear, And you even interview a few employees and ask them, who do you go to if this happens? And they don't know. You probably have a cultural problem, okay, associated with your compliance program. And that comes down to not only training and education, but also lines of communication. And these two things go hand in hand. So when you actually have policies that have been implemented, really the next step is making sure that everybody's being trained and educated not only on those policies, but that they're receiving compliance training just in general, right? And there should be maybe targeted training depending on roles, right? So your clinical staff might need different types of training as compared to your administrative staff, as compared to your IT staff members, as compared to other types of staff members, right? But in the end, that targeted training should also be developed again for board members and for C-level executives, making sure that they understand their role and their involvement in the management of the compliance program, exactly the same as it works for new employees. After employees have attested to those policies that have been implemented, it's a good idea to make sure that you're auditing those departments to ensure that they're being followed. We will revisit this again when we talk about risk assessment. In general, though, right, this training and education component, if you have an LMS, it usually training and education is where tooling becomes extremely important. It's just not possible once you get large enough to be distributing trainings manually or to be doing tons of in-person trainings and getting manual signatures and storing those paper records. It becomes very, very time consuming. And there have been many organizations that were audited and fined, even that had very robust in-person training infrastructure. Because what if somebody misses that day? What if somebody's out of office? If you're doing an in-person training only once a year or once a quarter, and there's people that could miss that, it could turn into a problem. Okay. We're going to get into effective lines of communication. Let me see. Okay, so Sharon said, actually, there should be 8 elements to include for no retaliation or no harassment. We cover that as well in this webinar, Sharon, so we'll get to that a little bit later. These 7 elements comes directly from the OIG. This is not something that we developed, just to be clear, okay? And usually the no retaliation and no harassment is even something that we cover on this slide as far as whistleblower protections and things like that. Okay. There was another question that came in, says, this is more of a comment than a question. I'm at an agency with a small mental health program that must comply with HIPAA, but our agency is largely educational, which is covered under FERPA. So P&Ps get complicated in a hybrid agency. Yeah, in that sort of environment, so for the person who asked this question, sometimes what you'll find is that you can consolidate policies where there might be certain redundancies that apply both to FERPA and to HIPAA, and you can create those policies in a way that cites both regulations. In most cases, there will be multiple regulations that need to be satisfied. And yes, that can definitely get a little complicated. There's ways that you can simplify it through consolidation, or just tracking them separately. That's the approach that we recommend. Right. Not seeing any other questions right now, so we will keep going with the rest of the webinar here. Right. Yeah, and Robert said, easier said than done. Yeah, it certainly is. We'll talk a little bit more as we go through, but if there's, and you can even send this into the chat, folks, or in the Q&A feature. If there's areas of these that you find to be particularly challenging, there are workflows that we can recommend. We have maybe 30, 45 minutes in a webinar to talk about a lot of this stuff. But if we see that there are areas that you want to particularly focus on, we can dig into it much further, okay? Effective lines of communication is the next element, and this can really refer to 2 things. In my mind, this refers to compliance leadership, ability to communicate down to their employees, meaning that the things that are decided on at the top should have ways of disseminating that down all the way to entry-level employees, okay? And that's what we talk about when we talk about that chain of command, right? Decisions that are made at the C level, disseminated down to the compliance executives, disseminated down to the managers and the directors and the employees. Okay. And that should be also in writing through your policies, and people should be trained on all that. Okay. Another area, and this is really what this particular element is driving at, is the ability of your employees to communicate with you. Okay. And what we were saying before is that if you are in an environment where you have 100 or more employees and nobody is ever reporting incidents, you're never hearing about potential compliance issues, you probably have either a communication problem or a cultural problem. There may be misunderstandings within the employees as far as who they're actually supposed to go to with what concerns. One of the things that you can keep in mind here is that people that raise compliance concerns are protected by the False Claims Act. Their identity should be kept confidential. The only way that this would need to be disclosed is if an actual government body is requesting information on it. But another thing to keep in mind is that the whistleblower rule does require that internally you have some sort of a mechanism for anonymous reporting. So, especially for those of you that are billing Medicare and are regulated under the CMS, that's going to be something that you are legally required to have in place. Okay. So, in order to make it easy for employees to do that, implementing some sort of an anonymous reporting mechanism, there are lots of tools out there for that. There are also ways that you could do this very affordably, even through things like Google Forms, or if you're a Microsoft shop, there are form tools that you could use through there as well. Some of them are difficult to do in a truly anonymous format, and then you need to take those reports and put it into a different tool if you're tracking incidents through there. It's one of those things, though, to keep in mind. If you're never getting compliance reports of violations or things like that, you probably have a communication or a cultural problem. And that would be something that we diagnose as an area that you should be considering and really seriously looking at. Okay. Risk assessment, auditing, and monitoring. At the beginning of the webinar, the majority of you said that this was a really big pain point or an area of particular concern for you. So let's spend some time on this. So, what is the goal of risk assessment? Risk assessment is a very broad term that is going to mean different things depending on who you talk to. So, for those of you that are more IT and security oriented, you might think of security risk assessments. There are also privacy assessments. There can be internal auditing of compliance programs. You could be doing audits for your accreditations. Those of you that are accredited through CARF or Joint Commission, maybe you're doing internal auditing and monitoring for things like that. One of the big problems that we see in a lot of organizations is something that we call audit and assessment fatigue, right? You have so many assessments maybe that need to be done, and so many of them overlap each other that there's just tons of redundancies in those processes. One of the things that we recommend is and there's ways that you could do this in a spreadsheet. It's usually easier if you have a tool, okay, that's specifically designed for healthcare assessments. But there's ways that you can cross map those things. That way you are creating, let's say, one assessment to rule them all, so to speak. Okay. Taking those assessments and going through the process of actually mapping them to each other, where you have all the needed citations rolling up to a single protocol that references HIPAA, CARF, security, privacy, right? All of those different things that it needs to reference. That is another thing that's easier said than done. But usually the time that you could invest into doing that is going to save you a lot of effort downstream, because otherwise what happens is you wind up needing to duplicate all of those efforts over and over again, and it creates a ton of extra work. Okay. Using our, and again, I'm going to give us a pat on the back here. This is one thing that our platform does really well. We have helped organizations build sort of that assessment methodology that cross maps in a lot of those different areas using our tools. And we were able to get organizations down from like 350 hours a year spent on assessment down to more like 50, okay, or less, depending on your size. That's really for a larger company. Question on what is CAR compliance? I think you're meaning CARF. So CARF is a very common behavioral health accreditation. Many of our clients just happen to be in the behavioral health space, so that's what came to my mind, Charles. But you might be more familiar with things like Joint Commission, or this every medical specialty is going to have a slightly different version of accreditation. Okay. Now, what needs to happen when you're actually doing those assessments? Again, make sure that you have an established review schedule. You might want to bucket your protocols in areas. So, hey, we're going to review this set of protocols once a month. We're going to review this set of protocols once a quarter. We're going to review this set once per year. If you can automate that, that's great. And again, for those of you that are in much smaller environments, there's ways that you could do this very, very simply, since your assessments hopefully are not nearly as complex. But in this sort of an environment, that's the approach that you want to take. Okay. Figure out how you can eliminate as much redundancy as possible. If things need to be reviewed frequently, set it up so that you're reminded to review those things frequently. If things don't need to be reviewed as often, put those on a different type of a schedule that'll allow you to spread this out a little bit. But the goal of risk assessment, auditing, and monitoring is to identify issues, right? So when you're doing those audits, you don't want to look at this with rose-colored glasses, right? You want to be specifically looking for potential issues or things that you're missing from a compliance perspective so that you can then implement corrective action plan. And that's really the next component. So risk assessment, auditing, and monitoring tie in with the next two elements really well, which deal with how you respond to offenses and how you develop corrective actions. And this is one area where I'll say more often than not, even when you look at the OCR fines, you'll see a lot of organizations. So let's say the OCR requires enterprise-wide risk analysis for privacy, security, and physical sites. Okay. The tendency is for organizations to complete that assessment once a year or to outsource it to a third party. And then they'll do that every year, but they don't actually fix the gaps that are found. Okay. Anytime that you find a gap in an assessment, what should be happening is that you are doing real investigation of it and implementing an actual corrective action or remediation plan to ensure that it's being addressed. Now, this goes two ways, right? So you should be implementing corrective actions when you find issues in your assessment, because that's how you show progress and how you can prove that you're making a good faith effort as a company. But also when you detect offenses through, let's say, some of those incident reporting mechanisms that we talked about. If an employee notifies you of an issue and you investigate it, you should be really well documenting the actions that you're taking to resolve that issue. And that is another area, the way that you typically get on the OCR's radar or the DOJ's radar is as a result of an incident. And if you're not properly categorizing things, if you're not properly documenting things, it can get you into trouble. If there's no disciplinary action taken, if you're not able to show a clear log of the steps that you took in your investigation, all of that stuff can come back to haunt you. And that then ties in to a few other areas, right, as far as showing good faith effort, which is actually enforcing standards, right, both through consequences as well as incentives. Incentives is a little bit more nuanced, right? It's kind of actually hard to really incentivize people to follow the rules, so to speak. I think some of this can be done through recognition, through different forms of encouragement. Get creative with it. Again, depending on the size of your company, this might be slightly different. Okay. I think one of the areas transparently where people struggle is actually in the realm of consequences. Okay. And this is something that it's a strange analogy, but I've got 3 kids. Okay. All of them are under 6. And one of the things that happens even in homes is if you have a rule that you want your kids to follow, but there's no consequences for breaking the rule, it creates an environment where those rules will be broken, okay, whether they should be or shouldn't be. The other thing to think about is if you have rules, there are consequences for breaking those rules, and you don't follow through on those consequences. What you're essentially saying is, hey, you can break these rules without any repercussions. And that actually encourages more non-compliance. Okay. So, and again, could apply with kids. That's just how I think of things with my kids, at least as far as behavioral stuff is concerned. But it's also really, really applicable to compliance environments because whether you think they do or they don't, your people know whether or not they're going to get in trouble for something or not. Okay. And it's not that you want to make an example of anybody. It's also a way that you want to make sure that you're never showing favoritism. Okay. The consequences should be well publicized in your policies, and you have to follow through when somebody violates those policies. Okay. If you don't follow through on those things, again, it is going to create an environment where people feel like they can break the rules without any repercussions, and that's inevitably going to lead to more and more people breaking the rules. Okay. When we talk about culture of compliance, that is one of the ways that you make sure that this is being established. Okay. So, we're going to talk a little bit about some other tips and tricks, how to make a better impact on your organization. In general, take your time with this. For those of you that are on here and you're feeling really overwhelmed, one of the things that I recommend beginning with is something as simple as you can go online and look up the healthit.gov risk assessment tool. That's going to lay everything out for you as far as what HHS requires for privacy and security and physical site auditing. You might want to look into other regulatory bodies for resources for assessment and some of these other regulatory requirements. If you begin with that assessment, I think it'll really help you in terms of uh, seeing the forest for the trees, so to speak. Okay. Often, let's say that you're trying to just start with policies. Beginning with policies can be really difficult because, well, what policies do we need? How do we even figure that out? Right? How many policies do we need? How do we write them? Who do we hire for that? Can we do that on our own? Usually, by starting with an assessment and then building a checklist of to-dos based on the results of that assessment, can be a really helpful way to orient yourself in the direction that you need to go as far as policy development is concerned. Okay. So, not a bad idea just to start with something as simple as that. And then as you're going through this, think about each of those policies, think about the processes and the procedures that you're setting up internally, and just ask yourself, can this reasonably be followed? Okay. Is it actually making sense for our company? Is it effective? And if the answer is yes, and you implement the policy, then that's great. Just continue to reassess, review, and update things as needed to be a better reflection of your environment. Okay. In general, if you don't have some sort of way of getting organized with this, create a system of tasks, reminders. Spreadsheets can be tricky because they're manual, but again, if you have that sort of a system with tasks and reminders and automation, it's a huge help. Automating any of these processes where you can alleviate some of that administrative work will enable you to be able to focus on what's going to make the most tactical impact. And for most of you that are on here, especially those of you that are in larger companies, you've probably felt this, right? Where you spend so much time on manual administrative efforts and processes and documentation that it feels like you're not actually doing things that are making a true and lasting impact on your company. One of the ways that you can alleviate that is by figuring out ways that you can automate some of these processes through tooling. Um, Depending, if you can get things approved in the budget that will make your life a little bit easier in some of these areas, that's great. Or if you just use the resources that you have more effectively, that's how you really want to be thinking and approaching this. Okay. And in general, when we talk about risk assessment, this is something that HHS requires anyway, but you want to have some sort of a risk matrix. Okay. So that you're assigning essentially like a risk score based on each of those protocols that you're tracking. Because there might be things that are really, really like a low probability, low impact, very low risk. There might be other things where, like, listen, if it happens, this could be catastrophic. It's high impact. And it's pretty likely that this could happen if we're not tracking it appropriately, right? Those are areas that you want to have in this quadrant. Tracking those things a little bit differently so that you are more prioritizing the high areas of risk as compared to the low areas can also be helpful, because then that helps you prioritize the time that you spend in each of these areas. You can focus more then on the really, really high risk areas as compared to the low, and somewhere in the middle for all of the other mid level risks. Okay. And again, there's no such thing as being 100% compliant. Okay. Those of you that have been doing this for a long time, you know that you never really arrive when it comes to compliance, right? This is a living, breathing process. That's why we call it a life cycle. This is something that you'll be going through progressively. It is something that usually, for those of you that are just starting to dip your toes in the water, or maybe you're in an organization with very little compliance infrastructure, and this all feels really overwhelming, it usually takes some time to really get a handle on this properly. Okay. But once you get a handle on it and you implement some of these things and you have some of that automation and those reminders and you get into a nice, steady workflow, that's when things start to become really easy. And you can then focus on just enhancing the program more and more from there. If you never get to that stage, though, of enhancing the program, you'll feel like you're underwater indefinitely. So sometimes really buckling down, focusing in on the areas that you need to focus on, completing those assessments, identifying your needs from policies, identifying your high areas of risk, really a powerful way to begin prioritizing and making this a little bit easier. If you are interested in more resources similar to this webinar, we have tons of free stuff on our website. All of our webinars are recorded. You can go on our YouTube page. We have some free guides on our website, as well as a full blog breaking down a lot of these things even further. I will also say, our platform is designed to fully satisfy all of these 7 elements that we've gone through today. We have a really robust risk assessment tool, policy training tools, vendor managers, incident management tools with anonymous reporting. It's a powerful solution and can be really helpful, but also very affordable depending on your use case. If you would like to get a demo, you can just get out your phone. You can scan the QR code here in the bottom left of the screen. There's also going to be a survey that'll pop up at the end of the webinar in the top right, just asking you if you'd like to learn a little bit more, and we can connect you with one of our reps here to just chat a little bit more about it. Again, only if you need it. There might be many of you on here that feel like you're in a really good spot as far as compliance is concerned, and that's great. But if you're at the point where you're feeling buried and you really are looking to enhance your program and automate as much as possible, that's where a solution like ours can really come in handy. We do also have specific tools and modules designed for very, very small practices. So if you're in that category, you need something a little bit simpler, a little bit more affordable, we can help you as well. Right. So again, just reach out if you'd like to learn more. My name is Liam. Again, I'm one of our senior solution engineers here. My phone number and my email are both up here on the screen. If you have any questions at all whatsoever, you could reach out to me. You can contact info@Compliancy Group. You can contact us for a demo. We would love to chat with you. At this point in time, I'm happy to take any questions. I have not actually seen very many questions come throughout the webinar. Oh, no, I was wrong. We've got a couple here. No, okay, so these were the ones that I answered previously. Okay, so question came through. What about remote employee issues, privacy, etc.? So technically speaking, there there are no issues with remote employees as far as the government is concerned. Usually, there are very specific types of controls that you would want to put in place as far as IT is concerned. It's not recommended that you allow employees to access, let's say, the EMR or company data through their personal devices. They should have like a company issued laptop that they can access records through, that it uses a secure VPN. You could speak with your IT teams about how that works. All right. Uh, The other thing is it's worth having a work from home policy or a telecommuting policy that just sets forth standards for what they're expected to follow and do as far as their work from home environment is concerned. Reason being, even if an employee then did something that they shouldn't have, if you have proof that your employees read and agreed to your policies covering those items and that they received training, that you did everything that you were supposed to do as far as training and educating that person, it's very difficult for you to be liable in the event of an audit because you have proof of good faith effort, right? You have proof of effectiveness. So, as far as remote staff, that's what we recommend thinking about. Okay. Yeah. So, question from Jean. uh, or Gene, we do have a program for IT providers and MSPs specifically. If you would like to learn more about that, we have a partner program. Shoot me an email and I can introduce you to one of our partner managers. We work with a lot of IT companies just to help them both as far as managing the data security component of this, but also being able to offer this to their clients if needed. I'm looking through to see if we have any other questions. All right. So I'm not seeing any other questions. Folks, thank you so much for joining. Oh, wait, no, I'm going into the chat here. Charles asked, can you recommend a book to get our feet wet? That's a really good question. I don't know of very many books that cover this topic without going super deep or hyper specific into certain areas. What I would recommend is you can, of course, follow along with our webinars. There's also the Healthcare Compliance Association, which has some fabulous resources. I think that that could be a great asset for you. I, I I'm having a hard time thinking of specific books to recommend, but if you look at some of the resources, even on our website or through the Healthcare Compliance Association, that could be a great place to go. Okay. Somebody asked, how should we manage third party compliance? So, third party compliance can mean a lot of different things, right? So, you might have 1099 contractors or consultants. The way that I think about this most often and where you usually have the greatest risk is with your vendors. Okay. So, there should be a formal vendor onboarding and vetting process, especially if the vendor has access to patient data. Okay. If there is patient data that a vendor is accessing, you need to have a business associate agreement that ought to be tracked and reviewed annually. You also should have an actual vetting process or some sort of a due diligence process that is performed on those vendors when they come in. Okay. So Mary mentioned HCCA Compliance One-on-One is a good starting place. Yeah, thank you for that shout out, Mary. Again, the HCCA has some fabulous resources. All right. And I apologize, those of you that are on here, you may or may not be hearing my kids outside my door that I had mentioned before. I'm not seeing any other questions here. Let me see. All right. So, folks, again, we really, really appreciate everybody's time. Um, I'm just making sure there's no other questions. All right. So, folks, again, if there are any other questions that we missed somehow, or if there's anything else that you would like to get, you can reach out to us. You can feel free to scan that QR code. If you send me an email as well, I would be happy to connect you with somebody on our team. All right. If anybody needs anything, we really appreciate you joining the session today. I'm sure an hour talking about compliance is maybe not the bright shining star at the top of most of your days, but for those of you that are compliance professionals, this is what we live and breathe, right? So thank you again so much for your time. Please leave us some feedback in that survey when you get off. Just let us know what you thought. Leave some feedback for me so that I can make these better in the future as well. Thank you so much, everybody. We really appreciate your time.